Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute pancreatitis, and we are looking at its causes. So here in acute pancreatitis, the common cause. So what are the common causes? The common causes, it includes the presence of the gallstones. So gallstones is the most common cause. Next in line, we have the alcohol as well as the post-ERCP. So what is the post-ERCP? ERCP stands for the endoscopic retrograde cholangiopancreaticography. Cholangiopancreatography. Next is the other causes. It can be due to the blunt trauma or the abdomen. So there is blunt trauma or abdomen. And next is post-operative. The post-operative, there is the cardiothoracic CT, next the upper GI as well as the biliary. Then we look at the hypertriglyceridemia, the hypertriglyceridemia, and then the sphincter of Oddi dysfunction. The sphincter of Oddi dysfunction. So these were some common causes. Now let's look at some uncommon causes. So uncommon causes, it includes the hyperparathyroidism. So there is hyperparathyroidism, and there is also the hypercalcemia, and there is also the deficiency of the apolipoprotein. There is deficiency of the apolipoprotein. So that is a C2. Next, there is the pancreatic divisum. Then there is also the periampullary diverticulum. There is vasculitis, TTP, connective tissue disorders, ischemic hypoperfusion. There is ischemic hypoperfusion states, and also the hereditary pancreatitis and the cystic fibrosis as well as the RF, that is the renal failure. Next, let's look at the drugs. So what are the drugs present? So in terms of the drugs, there is L-aspargine. There is L-asparginase. Next, there is also presence of the steroids, and there is sulfonamides. Next, there is tetracycline. Valproate, azathoprine, antiretroviral drugs, the estrogens, as well as the thiazide diuretics. Next, we move on to some rare causes. So here the rare causes, it may be autoimmune, that is AI. Next comes the infections. So these infections can be due to mumps. There can be the Coxsackie virus, that is the Coxsackie B. Then the CMV, that is the cytomegalovirus, as well as the presence of the parasite. Next, there is malnutrition as well as the presence of the scorpion bite. There is scorpion bite. To learn and grow daily like this, please do subscribe.